Imagine a human being with absolutely nothing inside their chest. No lungs, just an empty cavity. It sounds like science fiction, but in 2026 it became a reality. Surgeons at Northwestern Medicine have achieved the impossible. A patient survived for 48 hours without lungs, stayed stable, and lived to tell the tale. It all started when a 33-year-old man was admitted with severe respiratory distress syndrome. His condition was complicated by a superbug, a necrotic pneumonia caused by antibiotic-resistant bacteria. His lungs were literally decomposing inside his body, triggering a deadly septic shock. Traditional life support wasn't enough. His heart and organs were failing. To save his life, doctors took a radical gamble. To stop the infection from killing him, they performed a bilateral pneumonectomy. They completely removed both of his lungs. For the next 48 hours, the patient's life was sustained by a breakthrough technology, an extracorporeal total artificial lung, TAL. Unlike a standard oxygenator, this device didn't just breathe for him. It acted as a hemodynamic buffer, mimicking the physical pressure and blood flow of a real lung to keep his heart beating steadily. The results were stunning. Within just 12 hours of removing the infected organs, the patient's body stabilized, his toxic lactate levels plummeted, and his blood pressure returned to normal without the need for heavy medication. For 2 full days, the system worked perfectly, with no blood clots or technical failures. After 48 hours, a donor match was found. The transplant was a success, and just 8 weeks later, the man walked out of the hospital on his own. This isn't just a success story, it's a scientific milestone. Molecular analysis of the removed tissue proved that his lungs were so scarred they could have never recovered on their own. This case proves that for the most severe patients, transplantation is the only path, and the total artificial lung is the bridge that can keep them alive until they get there.